Okay, good morning, everyone. Good morning, DXN. So today on the 5th May 2021. So today we have some what do you call continuous of our class on certain product training and also Q&A. Before that, I will start about two products today. There's a new product coming into market. DXN introduced a new product called Garcinia. So I will share the Garcinia first, and later I will share about some black cumin. Okay. After we have completed this Garcinia and black cumin, we will start to go through about Q&A and open to the floor for the today's session. Okay. So I will start Garcinia, the product on Garcinia. Okay, let me share screen. Share screen. Garcinia. Okay. Guys, can you see? Hello, can you see the slides?
Yes, Doc. Can see, Doc.
Yeah, okay. Make it wider. Okay, make it wider. I still blur with these things. Okay, let me know whether the screen is moving or not. Because last time I see the screen is not moving. And nobody tell me. Okay, can you see the screen?
Okay.
Yeah, Doc. Good.
DXN Garcinia, good. Okay, this is a new product, DXN Garcinia. Actually, very good product. It has a lot of natural therapies, and it's under the nutrition and pharmaceutical thing, under nutraceutical effect. Okay. So, what is DXN Garcinia? Okay, actually, we are using the DXN Garcinia to weight control management. Okay, weight control management, because it has a hydrocitric acid which support normal fat and carbohydrate metabolism, a healthy appetite level, and optimum body weight. See, people that has carbohydrate metabolism, you see a lot of people taking a lot of carbohydrate and they are scared about diabetes, all this kind of thing. This product really help on the carbohydrate metabolism, and also can balance on your body weight. Okay, so you must remember, when taking DXN Garcinia, it's not like suddenly you have what do you call so you have right? Okay, I cannot enter admit the things. Somebody can admit the page members. See, there's two people in waiting room. Please check on that. So
Doc, you need to make me co-host. Otherwise, I cannot help you, Doc.
You see,
Yes.
When I change to the mode, my mouse is not working. Okay.
You have to put your mouse to my name under participant and make me co-host. Otherwise, I cannot help you.
Oh. Nobody there. Thing is, I cannot pin the mouse. I can't see the mouse. Let me, I stop share first. Okay. But the mouse is. Let me see. Zoom. How to change you as a co-host? Have to view, go to the chat room, is it? Let me
You right-click my name and then you can do co-host. You put your mouse on my name.
Mouse on Cynthia. Just now, I think Cynthia done it. Selena. Okay, more. Make a co-host. Okay. Okay, done. So I go back again. So now you can handle it. Okay, now you can see.
Can, Doc.
Okay, good. So basically it used for this what do you call, to weight management. Okay, if you see the Department of Physiology Research of Georgetown University Medical Center, Washington DC, they have done some research on it. In 8-week study of 60 volunteers, they reported Rich Shamla is a name, other name. Rich Shamla is in Ayurvedic name. Garcinia also they call it Rich Shamla in Ayurvedic name. Effectively in supporting normal weight, cholesterol, triglycerides, and serum lipid levels. So you see, it very important to balance your weight, to balance your cholesterol, to balance your triglyceride and serum lipid levels. So these are the things that always create some obesity in a human being. So Garcinia is one of the best product to balance this item. Balance these parameters, especially people who have very high triglyceride. When they do the blood test, they see the triglyceride level is very high, and also they see their blood is a bit thick. So these people can take Garcinia to for certain time, then they can see their result being improved. Okay, so actually is grown in India, most of the region in Konkan region, and southern district of Maharashtra. In Malaysia, in Asia also we have this kind of fruit, but very less, mostly in India. Okay, so it purely used for weight control management. Okay, we used to weight control management. Okay, so when you see what is in DXN Garcinia, other useful phytochemical in Garcinia, the component are garcinol, isogarcinol, xanthosimol, isanthosimol. These are the components in Garcinia. The herb function is actually basically more to weight management. Okay, when it comes to weight management, it also triglyceride management, cholesterol management, and lipid serum level management. So these are the things mainly used for that. Okay, the herb also will slow down body ability to store fat, potentially enabling more fat from food to pass through the body without being stored. You see, sometimes a lot of fat has been stored in the liver, and you have a fatty liver. So did Garcinia good for fatty liver? Yes, Garcinia is good for fatty liver people. Okay. Additionally, the hydrochloric acid blocks the production of storage of fat and cholesterol. Right? Is it disconnected?
No, but we see now is a blank screen.
Yeah, somebody is disturbed already.
You are still sharing screen, Doc, but you just need to go to your slides.
Yes, it suddenly go back. On the Zoom back. Can't share the screen.
We are still actually viewing your screen, you know, Doc, but it's just
I
black.
can't move anything. Yes, that's why. Wait. And meeting with cancel. It's still sharing, but I can't view it. Suddenly it's disappearing like that. Give me some time. Wait, it said I'm not logging, but you said I'm still logging in. Stop share first. Okay, I share again. Okay, can see again?
Yes.
Okay. Sometimes these things are okay. Never mind. So where we are in the okay, it actually balance the blood lipid level and naturally lower the cholesterol. Okay, basically Garcinia is more to weight management control. Okay, you need to balance the weight management control, then everything will be okay. So Garcinia is when you want to take Garcinia. Okay, so you see when you want to take what is the good things of Garcinia? Reduce body fat and maintain weight, help suppress your appetite and hunger cravings, boost energy concentration level, support healthy metabolism and cholesterol, diminish depression and gain motivation. Okay, so why diminish depression? Because when you are losing weight, you feel more cherished, more happy. So it's like gain motivation. Okay, so how does it aid weight loss? There are two main ways Garcinia through weight loss. Okay, studies red shows given Garcinia Cambodia supplements tend to eat less. Okay, so it's not to say eat less, your food is digested properly because carbohydrate is balanced. Some human study have found Garcinia suppress appetite and makes you feel full. So when you make full, it means you won't eat too much. It control your intake actually. Okay, that's why it's very good in intake. So when you eat, it's fully utilized. So your carbo is fully utilized into your energy. Then you don't eat too much. Okay. So appetite suppression, serotonin is known as appetite suppression. Higher blood level serotonin could reduce your appetite. Okay, however, this result need to be taken to grain of salt. Other studies have to observe. So these are the things the studies has been tested. So the link has been given there. When you click it, you can go back to the link. And may block fat production and reduce belly fat. Okay, it's really help on the fat production that increase the belly fat. A lot of people have a belly fat. So by taking Garcinia, it can reduce the belly fat. But if you want to get a good result, you need to do some exercise also. So you must remember, you're taking, let's say, you're taking Garcinia capsule, 1 capsule 3 times daily. The amount of 350 mg, you just take it 3 times, is like 1.2 gram. But 1.2 gram of Garcinia cannot fight like four plate of rice, cannot fight 5 piece of chicken that you take every day. Now how to fight? So you want to reduce fat, belly, all these things, you need some exercise. You also need to balance your food also. Then everything will go back to normal. So there's a one study for 2,800 mg Garcinia Cambodia daily for 8 weeks drastically improved several respected disease. Total cholesterol level 6.3% go lower. LDL cholesterol 12.53% lower. Good LDL is increased. Blood triglyceride 8.6% go lower. Fat metabolized under 25% excreted in the urine. So Garcinia help you to remove the fat from the body, balance it from the body. So slowly you can see your belly fat, everything start to reduce normally. And Garcinia has been used so many thousand years before. It's not a new product in the world, but it's already been highly utilized in Ayurvedic properties so many years ago. And it's really worked. That's why the product is quite good in the market. Okay, so what is Garcinia benefit? Garcinia, commonly known as Asam Kapeng or Asam Gulugur, Malaysia, commonly used in local delicacy. The fruit usually sliced, dried, then used at soup, curries, and so on. The leaves can seize antioxidant properties, able to also edible and used to traditional vegetable cooked. You can eat the raw. The food also can eat raw, and the leaf also you can eat raw. Garcinia capsule is a food supplement produced from Garcinia arthrovitis, the leaf. The leaf, we are using more to the leaf area and used for general head weight management, relief blood pressure and cholesterol, but basically more to weight management and to balance the cholesterol level. Once you balance your weight management and your cholesterol level, naturally your pressure will go back to normal. And the Garcinia that we have is 350 mg. We have 30 capsule, 90 capsule, and 360 capsules. Certified by Alal, Jabatan Kabajan Islam Malaysia, Jakim. And how it can take? You can take 2 capsules once daily before meal. People who suffer with gastric problem may consider to take after meal. You can take it there. And also consume together with the DXN supplement. You can take together, it's no harm. For pregnant lady, we have to see, because pregnant lady, you want to control cholesterol, these things, you must be very careful until you deliver. Okay, and because pregnant lady need weight management, need weight to go up, so you cannot lose weight. Okay, then shelf life of Garcinia is 2 years. Make sure you tighten the and keep in safe place lah. Okay, so this is basically more to what do you call on the what do you call Garcinia, that today we see the product. Okay, any question on the Garcinia? Before I go to black cumin, we'll go through a bit on black cumin. Any
Doc,
questions? Yes.
yeah, Doc. Is it the same with the liquid one? Is it as effective as the liquid one as well?
Which one?
I mean,
Liquid,
the
which one?
liquid. There is one Garcinia liquid in a bottle.
Morinzinia.
Morinzinia. It's different. Okay, okay.
Actually, Morinzinia also they're adding into it. Okay, they add it into it. It's good. Water based. It's a Morinzinia. It's a water based. Same thing. The thing is there lah. Morinzi mixed with Garcinia. So they call it Morinzinia. It's also same. It's the same lah, but they mix with Morinzi.
Okay.
And best we use capsule is much easier lah, because you want to use watery. It's hard to traveling. Is go around, then you only can keep in the house and only drink in the house. Like capsule, you can easy to manage it lah. You can go anywhere and you can take lah. That's the difference between these two things. Are almost same, actually nothing different. But the Garcinia, Morinzinia, you see it mixed with the Morinzi and Garcinia. There's a mixture lah.
Okay. Garcinia, is it available now?
I'm not sure on that water-based things, because we have so much of our enzymes. So people concentration is much less on that lah. But you still can take it. I don't know whether it's available now or not, but capsule is much better. It's a direct. You don't mix with any other things. It's a directly the pure herbs direct to our body. Morinzi you can buy separately, and Garcinia you buy separately. You can eat together. You don't need to mix together and eat. Okay.
Okay, thank you, Doc.
Good. Any other questions before I went to black cumin?
Yeah, Doc.
Yes.
I want to, is it okay also to consume it with monascus?
No problem. Monascus actually more to cholesterol, cleansing the vessels, all these kind of things. So Morinzinia, when I go through it, also almost same thing with monascus, but monascus is like comes from the brown rice, red yeast, but this is from the fruit. So people whoever said I have allergic with red yeast, all these things. You see, some people they have allergic with yeast. So for these people, you can recommending Garcinia, but you can take together monascus and Garcinia together. You will have a better effect, like very fast effect, very fast and effectiveness in your body. You can see that because it balanced the triglyceride level actually. Monascus more to the removing some of the plaque, all these kind of things. And this is more to the belly fat, more to liver fat, like that. Okay.
Okay, thank you, Doctor.
Good. Any other questions? Okay, if no questions, I will go on with the slides for black cumin. We will see on the black cumin. Share screen of black cumin. This is black cumin. We call it Habatul Baraka, the seed of blessing. Okay. And you can see black cumin consists of 3 items: the clove, the pepper, and the cumin, black cumin itself. So we have 3 in 1. That's why they put black cumin plus. Okay, we have clove and black pepper. So it's the clove and black pepper is very good for the lung problem. That's why we give black cumin for this COVID patient. It can suppress and kill off the bacteria or viruses in the lung area. The infectivity of these viruses, black cumin can make it better. I've treated using black cumin with pneumonia patients. It's really effective. You can see the total changes of the pneumonia patient after 1 week treatment with the black cumin, and the patients come back normal again. Okay, it's a herbaceous plant. It contains very high calcium, omega-3, 6, and 9, protein, vitamin B complex, and various type of minerals. Traditional used thousands of years ago. Okay, so what is the health benefit from the DXN black cumin? Treated many diseases in Middle Eastern countries. Black cumin seeds were first found in Egypt. Essential fatty acid that contain omega-3 and 6, unsaturated fatty acid. Generation of immune system, reduce inflammation, and protect against heart disease. Because you see, it has omega-3, 6, and actually there's another one, it's omega-9 also they have actually. So we have all this kind of omega. They're really good for the heart protection. That's why whenever people have heart problem, normally we will give a fish oil that contain omega. Instead of giving fish oil, we can give them a black cumin. Is 100 times safer and not is an animal fat. This is pure herbs and pure natural things. Okay, Nigelon is one of the antihistamine and anti-asthmatic. So when people got asthma, when you start to give in black cumin 1 capsule by 1 capsule in a long run, we can see the asthma will be slowly reduced and become normal person. It also immunomodulator, reduce autoimmune disease and balance immune system. People who have lupus, people who have autoimmune disease. So whatever is autoimmune disease is like cancer, all these things is under the autoimmune. Okay, so you can give a black cumin to balance back the immunity. It also have a polysaccharides, prevent colon cancer, disease resistant, stimulating bone marrow, and normalize body function. Okay, disease resistant means like stimulating bone marrow is balance back the bone marrow. Can be given to leukemia patients. Okay, very good for the leukemia patients. And if you see in the DXN black cumin, we have added with cloves. Okay, so cloves increase hydrochloric acid in the stomach and improve peristaltic movement, hence improve the digestive tract. Black pepper also added, stimulate the taste of buds in such as way that an alert to send to stomach to increase hydrochloric acid secretion, therefore improving digestion. Okay, hydrochloric acid is necessary to digestion protein and other food component in the stomach. When the body production hydrochloric acid is insufficient, food may sit in the stomach for an extended period of time, leading to heartburn or indigestion, or it may pass into intestine where it can be used as a food source for unfriendly gut bacteria. So black cumin plus is compactly designed with 3 items: black cumin, cloves, and black pepper. These 3 items is very powerful item to balance the overall heart and the digestive system. And if you see, Nigella sativa black cumin has been proven very effective as a bronchodilator, equally potent as theophylline and salbutamol. So theophylline and salbutamol normally used for the patient that has an asthmatic patient. So random human clinical trial done in Indonesia 2007, Germany 2008, and Iran 2010. We can see that a lot of balancing happened for the asthmatic patient after using a black cumin. So healthy cholesterol profile support, some research support that crushed black cumin seeds and help support healthy cholesterol profile. It also very good for the skin health support, because this supplement typically contain additional ingredients such as beta carotene, biotin, and vitamin E. And respiration support, current studies that oral supplement like Cumin may help support breathing pattern and normal rhythm. Okay, and it help you to cleanse off all your mucus, everything go back to normal. Black cumin able to support healthy digestive system. Okay, so these are the things that very important in our daily life, that we should not ignore it, and must take daily to make sure our system work well and work properly, and this will lead to healthy lifestyles and to go on. Okay, so any question on that? Any question on the black cumin? It's very quite a simple product knowledge that help you understanding on what are the criteria that we use this product, and you can recommend to the patients or recommend to the friends that has this kind of scenarios, issues, and this will lead to better healthy lifestyles. Okay, good. Any questions regarding black cumin? Guys, anybody down? If no questions, we can start to answer Q&A session. Okay, Selena, we can go on.
You want to pause the questions, yeah, Doc?
I have the question, I can read.
Oh, you have, okay,
Yeah.
all right.
It's a 10 questions today, is it? Okay. So if now questions, things I will ask, okay, we'll go on the question that posted in today. We have 10 questions to be answered today. The first question is, what is the remedy for patient that suffer carbuncle, has undergone operation to remove the skin infection? Okay, undergone operation to remove the skin infection. How bad it is? Okay, we have to see how bad it is. What is the consequences of this operation? And it said undergone operation to remove the skin of infections. You can actually we have to see the condition first, because this kind of questions we have to see the condition, and based on the conditions we can advise them what to do. Okay, so it's very general questions, and we need to understand the patient's conditions. Maybe they can send a picture, or they can tell me what is the reality now is going on the patient, and is it already healed, or it become more damaged, is infected with the pus, is it infected with the skin that not healed so long. We have to see it first. Okay, so who posted this question? Can anybody come out and get me some more information on that?
Dr. Leslie, I think you're in the room, right? Dr. Leslie, can you highlight for Dr. Siva, please? Thank you.
Hello, Dr. Siva.
Yes. Okay. Can you explain more on that?
Yeah, I actually do not know much about the patient, but because I just received a call on his condition, so he was admitted to the hospital because of this disease, carbuncle, and he was in the operating room just now when they called me. And he had a previous case, similar case, but it infected his the other parts of the body, and this time it happened not to the same part, but another new 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 the other parts of the body. So that is as far as I can describe.
Okay, see, the carbuncle actually is a like cluster of boils. It's happened into the body system.
Yeah.
Up to the you can see from the skin. It's like boils, you know. So the boils got a few category.
Okay.
Water-based category,
Yeah.
pus-based category, blood-based category. So many kinds of things. So that's why we need to know whether it's infected category, is uninfected category, or what is the reality on the carbuncle situation. But most of the time they will do operation on it. They will remove it, and they will give some antibiotics and polish it. But in a long term, we have to see this is happening from what kind of source of a problem. Okay. And we have to see where this person, what is he is loving food, where he's work, all this kind of environment we need to see. And we need to understand where the infection is started, where it comes from,
All right.
whether inside toxin or outside toxin, we don't know yet. So
Okay.
that's why this kind of things all we need more clarification from the patient. And with the information, when the patient give us back, then we can give them a good idea what are the product to be taken, and what are the things they need to avoid. Like for example, like you see some people have rashes in the skin every
Uh-huh.
time when they use a soap. So like for example, so then we advise them, okay, rather than use the chemical soap, you can use a organic soap. These are the things we need to advise them, but we have to see what is really a trigger, the point of this problem. Okay,
Yeah.
from there we can advise them more clearly,
All right.
and we can advise them how to remove the toxin out from the body clearly. Okay.
Okay. Yeah,
Okay.
Dr. Siva, I'll keep in touch with you on the
Okay.
patient. Yeah,
Correct.
thanks a lot.
Correct.
Okay.
Okay. Good. Good. Thank you.
Thank you. Thank you.
Okay. Question number 2. Baru selesai operation batu karang, apa produk yang sesuai untuk pemulihan? Okay. Before you talk about pemulihan, first things you need to understand why batu karang happened and how to prevent it. Okay, prevention is the first things you need to understand, rather than you go always to pemulihan. That means you after operation you pulih for 6 months. After that, after 2 years, batu karang come back again. So you must know how to do prevention first. Okay, the first thing why batu karang happened, because of the acid in the stomach not properly used. A lot of people have batu karang. First of all, they don't eat in a proper time. Okay, eating at the proper time frame is very important to neutralize the acid in the stomach that produced naturally by time frame. Okay, that's why I always trigger everybody, make sure you get your breakfast 7 to 9 a.m., your lunch 12:30 to 1:30, your tea time 4 to 5, your dinner 6:30 to 8:30 maximum, finish. After 8:30, don't put any junk into your stomach. You can go for drinks, okay, like a milk, warm water, plain water, it doesn't matter, but no strong food or solid food into your stomach after 8:30 p.m. Remember that always, because body lost ability to digest the food after 8:30 p.m. Okay, our digestive system is work on the sunlight. Morning 7 o'clock sunlight start, night 8 o'clock it disappear. So our digestion only happen daytime, nighttime won't happen. This has been trained so many thousand years from our ancestors. So understand the nature and understand the holistic way of living by our ancestors. They're doing great job. After 8 o'clock, they don't eat anything. The worst case scenario, they just drink a milk, or they just drink a water, this a thing. Or worst case scenario, they just put a little bit of oats or a little bit of cereal, the very mild kind of things of food into your stomach after 8:30 p.m. Okay, so when you do that, your acid hydrochloric properly digested with the food and fully utilized for digestion. So you won't storage inside your stomach and go to your small intestine, and from small intestine the acid penetrate towards your bloodstream, and you end up with your kidney have to clean up the acid hydrochloric as much as possible. If you stop at the first plate, eat in the correct time, everything become neutralized in the first place. Then you don't have any additional things that put into your bloodstream and end up into bladder stone, kidney stone, all these kinds of things. Okay, this is the first thing you need to do a prevention. Eat on time, balance your food. Okay, and munch properly and eat after eat half an hour, only drink water. Then you can see you won't produce patukarang at all. Completely you solve the issue. Okay, for people who already done the operation, people don't have done the operation or done the operation, the product is the same. You can take codipine 10 ml, vinaigrette 10 ml, either honey vinaigrette or normal vinaigrette, Morinzi 10 ml. Okay, you can add in Richelieu 1 scoop, or you can separate RGGL 2 capsule separately. So the water you can mix in a glass of warm water, you can drink, and you can take you can mix with the Richelieu 1 scoop into the water, drink 2 times or 3 times daily, or you can take a vinaigrette, a codipine, Morinzi 1 shot, you mix with the water, you drink, then RGGL you separate it, and also take spirulina to alkaline your body more. Okay, once you take that, you can also prevention and also healing back the operation things that you have done, and also you can prevent the things won't come back again. Okay, question number 3, pregnant woman low hemoglobin, what to take? Very simple. Pregnant women need more hemoglobin, need more blood. Lot of pregnant women is under the anemic control. When they are in anemic, they have a lot of issues from headache. The baby is not fully utilize the blood, because baby need a proper blood supply to make sure the baby is healthy. So when the hemoglobin is very low, the baby also feel not very healthy. That's why we have a lot of children, the baby not complete 100%, end up with autism, end up with some organs not completed properly because the blood level is low. So in DXN product, the best to give a pregnant lady, Fruitzim, Morinzyme, GL, and RG. Okay, you can give RG and not to give RG also doesn't matter. Okay, but the important is Morinzyme, Fruitzim, and GL. These 3 things is very, very important. And Roselle tablet, ask them to suck. 2 tablets 3 times daily you suck, and give him spirulina. So there's a 5 item: Fruitzim, GL powder, Morinzyme. This is for the enzyme, and the GL for the oxygen. And you give spirulina and Roselle tablet. Roselle tablet suck in the mouth to make sure you don't have any giddiness, anything. So all my pregnant lady came down, I give the Roselle to keep on their hand. Every time they can put it when they feel a giddiness. At the same time, they just take 2 tablets 3 times daily. And also when emergency time, when they have a when they have headache, giddiness like that. Okay. So question number 4, bayi baru lahir masalah susah berak, seminggu berak hanya 2 kali, any advice? Okay, bayi baru lahir susah berak, you must see, baby born, at least you must give at least 1 ounce of water, little bit, small amount of water you need to give. But current view, the doctors always say don't give water, don't give water. It's not good. Even though you give them a breastfeeding or milk, you must give little bit of water, at least 1 to 2 ounces per day you must give. Okay, and the best what you can do, you can take a mother's milk, mix with 2 drops of virgin coconut oil, apply to the tongue. Okay, you can do it early morning every day. You can do that, and you can give the baby GL. This is the best things you can give for the baby for time being, and you can see the toilet become normal. Okay, I repeat, you can give a GL powder, mix in the mother's milk or mix in the bottled milk, 1 to 2 capsules to 3 capsules per day, no problem. Okay, and you can take a mother's milk or the normal milk, few drops, with 1 to 3 drops of virgin coconut oil, our DXN virgin coconut oil, mix it together, apply to the tongue, let the baby take. So it will help to ease the digestion metabolism to the baby. I've given that to lot of babies, and they are all recovered perfectly. You no need to worry at all. The product is very safe. Okay, I've treated so many babies. Okay. Number 5, budak 3 tahun masalah mata rabun. Okay, budak 3 tahun masalah mata rabun, actually the baby, the boy don't have enough nutrition. Okay, give them more spirulina, more GL, more Roselle vitamin C, Roselle tablets, Roselle juice or Roselle vitamin C or tablets, whatever it is. Give them maximum spirulina, give them maximum GL. So it's a like nutrition deficiency. So we have tested in Pakistan, DXN have run Pakistan for the night blinders. Okay, we have a lot of night blinders in Pakistan that now after taking GL and spirulina, they can see well clearly. That means it's nutrition deficiency. So the kids might have the nutrition deficiency, balance them with the spirulina, GL and Roselle. Okay. Number 6, masalah sesak nafas sukar bernafas datang menyerang tiba-tiba. Okay, masalah sesak nafas bernafas menyerang tiba-tiba mean anxiety. Okay, you feel anxiety. Whenever you have an anxiety feeling, what you should do, you just sit down, relax, close your eye, take a relaxed deep breathing. Take a relaxed deep breathing. Breathing in and breathing out. Okay, you count from 10 to 0. First, you try 10 to 0. Breathing in, fully breathing in, slowly breathing out. Okay, 10. Then breathing in, breathing out, 9. So you go on like that. Do a breathing exercise first. Once you start to do your breathing exercise, your anxiety will go back to normal condition. Okay, the one is attack just suddenly is actually anxiety. Okay, you need to control your anxiety. It's in your hand. Okay, no tablet needed. But what you can take, you can take a GL. You can take a GL powder. After you feel better, take more GL powder, mix it in the water and drink. Then you increase your oxygen level in your body, in your blood. Okay, number 7, how to stop smoking. DXN can help. Okay, I've done a lot of patients that came down to stop smoking. And that's why I always say, if they really want to stop smoking, it's also is the patient discipline. If their discipline is good and they think they really want to stop, then they can stop. If you are trying to make them stop, whatever you give also, they won't stop, because it's a discipline problem. Okay, attitude problem. So, but what you can give RGGL, you can give a black coffee, and also you can give them a Roselle tablets. Give them a Roselle tablet box, the 120 tablets. Ask them, whenever they feel want to smoke, just take one tablet and suck. Okay, you can suck as much as possible the Roselle tablet. No harm at all. The more they suck, the more tar and the nicotine that storage in their throat area towards the stomach, towards the lung. The Roselle slowly will remove it. And in the long run, they can see they have been changing to reducing the smoking little bit by little bit. But that's why I say, I repeat back, it also, they must have a discipline and proper attitude to stop it. If they don't have that, whatever God give also, I tell you, they won't stop. Okay, until they will get lung cancer. Once they got lung cancer, they come and sit down in front of me. They will tell, hey, the doctor, I already stopped smoking. Now you tell for what? Okay, so it's too late. Okay, so number 8, kencing berbuih. Okay, don't confuse yourself with kencing berbuih. I see so many patients come and say always, my kencing berbuih. Don't worry on that. Don't assume anything. You want to see whether your really protein go out or not, you do the urine test. Don't simply go to the toilet and you check yourself. Oh, I got kidney problem, I got this problem, I got that problem. No. Okay. When you eat a lot of oily food, that day night you will have like oily kind of things. Your urine become like buoy a little bit. Okay, bubbles. Okay, so don't ever. When you have bubbles lot, try to drink a lot of water. Try to drink our spicati. Try to drink our codipine. Okay, and see whether it's still happening or not. Then go to the test and do a urine test, urine Fimi test. When you do the urine Fimi test, we will know that what is happening to your system. Okay, you can do the blood test, urine Fimi test. Don't do own assumption. This is actually a lot of patients come and see me and tell, hey, I got kitchen babue. Is it my kidney problem? Is it nothing? I said it's okay. Okay, sometimes your lack of water. Okay. So number 9, ada batu karang belum lagi kena operation. Okay, so same thing, the product I told you. If you got a batu karang, you want to break the batu karang, very simple. You take vinaigrette, codifine, Morinzi, RGGL, or you mix with the Richelieu into the Morinzi solution, or you take RGGL separate. Then drink virgin coconut oil every day. This will help you to slow down and minimize the stone and slowly will come out from the urethra. Okay. Number 10, what to do to improve memory? Okay, to improve memory is very simple. You can take GL powder, cordyceps powder, lion's mane powder, mix in the morinzyme and drink every day. This will improve your memory. If old age people, I give you the high dosage, I mean cordyceps powder, lion's mane powder and GL powder. If young people, to improve memory, take RGGL, spirulina, balance your enzyme, then your memory will always okay. Okay, clear? Okay, so let me see everything. Okay, there's some question posted in a group. Let me see how is it. Okay, everything okay except cholesterol and sugar. Can take this. What to take this? I don't know what they're trying to say. Is there any changes on the diabetes reading chart recently by the World Health Organization or still the same? Is there any different reading? Is there any different reading for the existing diabetic people? If yes, please give the reading measurement. Okay, you see here. Whenever you check, when your reading is below than 10, nothing to be afraid. Do some exercise, drink more water, balance your exercise, and change your appetite of food. Diabetes is not a disease. Diabetes things that we need to manage properly. Okay, we need to. It's a management by each and every individual, not managed by somebody in a pharmaceutical company to manage you. They never manage you. You follow up with them 20 years or so, nobody manage you. End up with more disaster. You need to understand this protocol. Okay, there's no about sugar 5, sugar 6, sugar 10, sugar 20. When you keep on taking medication system, the drug system, this will end up with disaster. This will end up, your sugar will be uncontrolled management. You see, sugar, glucose is actually a changeable variables. You cannot make it a fixed variable. Okay, remember, you cannot, nobody can make it fixed variable. When you start to make it a fixed variable, you will have a bigger impact on your body system. This will lead to more damages and more. You see, lot of dialysis patient, is it because of taking medicine or because don't take medicine? People don't take medicine, not in the dialysis center. People taking lot of medicine, drugs, insulin, everything, end up with dialysis center, end up with losing leg, end up with losing their eye. Because diabetes is not a management that you need to control by the with the drugs. You need to control by food that you eat. You need to balance your sleep. You need to balance your food. You need to balance your exercise. Okay, so it's a management protocol. It's not a drug protocol. That nowadays people are so weird about, I got 6, I will die, kidney failure. Hey, people are taking insulin 4 times, make sure they are eating, your sugar never go up more than 5, end up with dialysis. What are you going to tell on that? Okay, end up with losing their leg because the drug side effect. So if this patient totally change by attitude, slowly stop all the drugs, manage their food. Okay, you must understand, glucose is derived from the starch. If you stop starch, there's no glucose. If I give you fish and vegetables, you have no starch, no glucose increase. Today night, you eating fish with vegetable. Okay, it's not fish and chip, fish and vegetable, not chip, no chip, fish and vegetable. Your sugar won't go up because you never put any starch inside it. So when you don't put any starch in, why you go and put 20 mg IU of your insulin? What's the point? What is insulin going to do with you? Okay, you won't help anything, because remember, starch will convert into glucose. If you don't put starch, nothing will happen to your system. The insulin that you put, the medicine you put is just a waste of management. Okay, so if your sugar is below 10, you don't need to worry. Don't scare first. If your sugar is more than 10, manage your system, balance your food, balance your exercise, sleep 6 to 8 hours daily. Make sure up to 8 o'clock. After 8 o'clock, don't eat anything. You must have 10 to 11 hours every day starvation. You only eat at daytime. You should not eat anything at night time. You only allowed to drink at the night time, not food at the night time. Okay. The problem is nowadays people 10 o'clock, 12 o'clock, 1 o'clock in the early morning also eating. Then morning wake up, high sugar, end up with diabetes, they say. Actually, diabetes is a metabolism weakness. It's not a disease. Understand that. It's not a disease. Okay. Slowly, when you start to manage it, things will come back under your control. Don't make somebody control your sugar. You need to control your sugar. You need to manage your sugar. By putting a drugs, putting a insulin, all these things won't help you as much. You end up with disaster. Okay, trust me, I've treated so many thousand patients. Now a lot of patients already stop everything, and now they are okay. They don't have to taking insulin, but their sugar is stable. Why? Because they stop starch. They only take starch lunch time only. Morning they change to millet. They change to some whole grain meals. Okay, stop taking all the breads, wholemeal bread, Garcinia bread, I5 bread, all this bread bullshit. They are putting a lot of sugar inside it. And stop taking all the saturated sugars, changing to natural sugar. Okay, lunch, take a small bowl of rice, take more veggie, more fish. Tea time, take a black coffee without sugar. It will help you. Night time, go for chapati. People always say chapati. Chapati also don't mix with the gandum chapati. Mix the real chapati with the flour, real flour. Go for millet. There are a lot of choices that you can eat at night. So change your food. Okay, every day, 30 minutes to 1 hour, sweat your body. Sweat your body is very important to remove sugar. Imbalanced sugar that under your skin will be removed. Okay, one every day. Then sleep 11 o'clock sharp, up to 6 to 8 hours sleep per day. This is all will balance your sugar in your body. When you keep on doing these things, you can see the sugar level will go back to normal condition, and you don't need to poke and check for what. If you are normal, you can do your work, you can balance your system. You poke for what? If the sugar showed 20, you are normal. Why are you worried about? If you're putting 4-time injection, you eat also, the sugar will go back 20, it won't be less. Because after you putting your insulin, taking medicine, you never check your system. Okay? You feel that, oh, your system is controlled by the sugar. You think after putting insulin, putting tablets, evening your sugar always 5. No, sometimes go 7, 8. You never check, because you go never every hours you go and poke and check. Okay? So maintain your system, balance your system. Then everything go back to normal. Okay, so I think this the questions that posted at last. I think hopefully you understand the thing. I will cover one day about the sugar. Maybe the next 2 weeks after, I will prepare a slide on the sugar. So diabetes, what you should eat. That's why our starch, our amylase is very important. When you eat, make sure you munch properly and eat. Okay, water only take after 30 minutes after your food. Don't take immediately when you take food. Okay, make sure when you do exercise, you sweat. Sleep 6 to 8 hours daily. Be positive. Reduce a drug as much as possible. Drug is good, I don't say bad, but you cannot take in a whole life. This will make your disaster. That's why our dialysis centers are increasing tremendously. When the kidney gets start to fail, if early stage they come to see me, I can reverse it and give them back their kidney back to normal. None of the hospital will do this. Okay, none of the medical system can do that. But I have reversed so many cases. We help them to change. Okay, so not to damage the system. Good. Okay, any Q&A from the floor? If anything, you can unmute the mic and you can talk directly to me.
Yeah, thank you, Doc. Very good lecture.
Mm.
Any more questions?
Dok,
Hi.
my cousin pernah accident last 20 years already lah.
Mm.
Then, but he survived, syukur.
Mm.
But the problem now, dia punya kepala kan can
Hmm.
turn pergi ke belakang, Dok.
Oh, so bad. Pergi ke belakang mean what? He cannot turn his head properly, or the head just twist like that.
The head can twist macam 360.
Oh my God. Oh. Mm. But is it impact or he suffer from any pain?
I'm also not so sure.
Maybe some of the muscle are breakdown or whatever lah. You can
Yeah.
apply the Gano oil. Try to give him the cordyceps powder and GL powder mix lah. Lion's mane, cordyceps, GL powder, and lion's mane powder. These will strengthen the muscle, and apply the Gano oil and massage every day at the neck area, like the shoulder and neck area lah.
Okay.
Okay.
Okay, thank you.
Okay, good. Any other questions?
Hi, good morning, doctor.
Hi, good morning.
Doc, one of my friend's mother,
Mm.
she's been going for dialysis. She got multiple sickness.
Mm.
She's asking whether she said immune system is not strong.
Mm.
She wants to know, she doesn't want to go for the jab.
Mm.
So she's asking our opinion.
Currently, she are doing what? Dialysis.
Dialysis,
Okay.
1 week, 3 times.
Okay. For time being, better dialysis people, organ transplant people, not to take the vaccine for time being lah, because they are complicated patients.
Yeah, that's
Okay.
why she is worried.
But hospital, they don't give what they know. If you're complicated, they don't give you what.
No, they are asking to register.
No need. No need. Because if people are really complicated, like organ transplant people, dialysis people, their immune is very slow. So this patient, for time being, the research data is not enough to balance the vaccine. So they can tell the doctor what. Maybe they ask him simply dialysis, but when come to the time, you tell the doctor, they won't prescribe. Even though you are very chronic chronic arthritis, chronic allergy, you can excuse for time being. So what she can do, she can excuse for time being, and she can tell to the doctor. If she is dialysis, I don't think dialysis people need to, for time being, is open for vaccination. I don't think. So better check with the doctors lah, and hold on first lah, until a further notification from the Kementerian.
Hold on first, lah.
Hold on first. Better hold on first. Get the clarification from the doctors, because for time being, I think dialysis patient not necessarily needed yet, because there's no data enough about their patients' credibility, effectiveness on the vaccination for these dialysis patients. Or you can check with the doctors, see what they advise. But I think if you tell, they won't give you. Anything happen, then they cannot.
She itself saying not enough immune system for her.
Yeah, because the immune is
Sorry for
low.
that.
Then you going up for what? Because every day you are sucking out the blood. What?
That's why she feel she is not strong enough.
No. Not time being. Maybe the further version coming in into the market, that tested one, but not now. Ask her to relax first.
Okay, thanks, doctor.
Okay, thank you. Okay, any other questions?
Yeah. But at times it's also a concern, Doc. The hospital itself will just register their patient for COVID vaccination.
Yeah, these people sometimes they got, but you must be very careful, because when patient have a lot of complications, like my sister, she have like last time she was with chronic eczema allergy. Even though she recovered, but she's scared because she have gone through the trauma of the eczema. So then he told the doctor that she not intended because she got a chronic eczema problem previously, and now it's already subsided, and so far she's okay. So when you tell that, then they said, okay, hold on first. So they put under KIV. So it's still long run to go. Okay, it's still long run to go, and see if you have really have some kinds of chronic things, make sure you tell the doctors. And if they ask why you don't register, you can tell them why you don't register, because until come to your patient, your level, they will come and talk to you. They will come by layer by layer. It's not simply they call you and push you. They don't force you and pull you and put you the things. Okay, so relax first. Don't be too rushing. Okay, there are a lot of things need to be find out on the field, and still we can see still is like in new things is going on. Still data collection is not completed yet, still on testing. Okay, good.
Next session is on the 19th, Doc.
Yeah, 19 May. Okay, sure, 19 May, correct. So we will see on that day. So if no questions, thank you for the time, and hopefully we have a good day today, and have a nice day. Please be safe, and RGGL, Black Cumin, Roselle, and Androgy will help you and your family. Make sure you maintain it and safe side. Don't go around with a lot of people area. Be safe always. You see, there's somebody already wear the thing. Audrey photo with the yellow cap. Safety first. Okay. Okay. Thank you, guys. So see you on the
Thank you much,
19th.
Doc.
Okay. See you on the
Okay,
19th.
Thank you, Doc.
And thank
Okay,
you.
thank you.
Bye-bye.
Night.
Good morning.